Hey, it's Lead Poisoning Prevention Week in 2 weeks. It's Children's Environmental Health Month. And we are glad to open the Lead Poisoning Prevention Commission. Here we are, everyone's just for the record, we are on an alternative date today because we wanted to honor the Jewish holidays and Yom Kippur last week, and we wish all who have celebrated Rosh Hashanah and Yom Kippur all of the best. As we open today, I'm Ruth Ann Norton. I am the current chair of the Maryland Lead Poisoning Prevention Commission, which was established by the Maryland Legislature in 1994. I want to just say that one of the things that I think we all read or may have seen in the newspaper in the last couple of days is that the case for green environmental that we have been discussing for the last several months, and for which I think gives us a lot of things to truly focus on, was the pleading of Mr. Barkley in court to charges brought by the Maryland Attorney General. So I want to just commend Chris Corzine and the group with the state attorney or the Attorney General for MDE for bringing these charges. The state is still pursuing civil penalties as well as criminal penalties to underscore the importance of what occurred. And we'll talk a little later in the meeting today. The state's going to be pursuing a bill to ensure that every inspector will have liability insurance and other things that they believe will strengthen against having the fraud that was brought on Maryland citizens. But Fred, I didn't know if you or somebody from the state wanted to say anything about it, but there are 2 articles. There's an article in the Banner, and there was a joint article between Fox News, local Fox News, and the Sun that covered this. But is there any more that you would like to say?
Yeah, they're having, I think, sentencing in February. The Environmental Crime Unit had reached out to myself and a couple of the people in the lead program to attend, maybe to provide an impact statement of what the ramifications were for the crimes committed, to assist with sentencing. So we're looking at possibly doing that as well.
Is that ability to make an impact statement open to the public?
I will check.
Okay, because I think there are advocacy groups and potentially GHHI that would like to comment on the undermining of the public faith that this has brought. But I wanted to kind of start with that headline. We can talk more about it. I know we need to get to our roll call, but I do see Commissioner Hutchinson has raised her hand.
Hello, thank you so much for this update. I am really glad to hear that the criminal charges have worked out in this way. I just remember previously that there was mention that he was also potentially accredited in DC, and I was wondering if there had been any continued coordination between Maryland and DC around the potential impact to folks in DC.
Yeah, so probably around February, March, we meet with DC in Region 3, which is West Virginia, Delaware, and Pennsylvania, monthly, I guess. This monthly meeting, and through the Environmental Protection Agency. And we made them aware of the case as soon as we filed charges, and DC was one of the jurisdictions that reached out to us and said that he had applied for accreditation. We were sending information back and forth to them up until April. So I haven't really heard anything new since April, but I will follow up with them to see if anything is going on. But
Thank
yeah,
you so much.
yeah.
Okay. Well, let me give a heads up to Bay Hanson if she's on the line, that we're gonna ask her to put the summary of the survey up after we do our general work of formally opening the meeting. Wendy, can we do the commissioner roll call, please?
Yes.
Wendy. Okay. And good morning, Wendy.
Good morning, everyone. I know we got a little bit of a late start, but I thank you everybody for your patience. And we've got a quorum, so I will call the commissioner names. If you can just introduce yourself, that would be great. Adam Skolnick.
Adam Skolnick, Executive Director of the Maryland Multi-Housing Association, Commission member.
Ally Nestat.
Wait, Allie, I thought you were bringing your youngster today. Where'd she go? Did she step out?
She was,
Yeah,
well, I see her on.
okay.
Maybe,
Well,
oh, she's having, yeah, okay, so I see her on there, but her sound is not working. So, oh, she's sorry. I know some sign language there. So, okay, we'll go ahead down to Barbara Moore.
Hi, I'm Barbara Moore, a pediatric nurse practitioner, director of the lead poisoning program at Mount Washington Pediatric Hospital, commission member.
Benita Cooper.
Anita Cooper, Executive Director of Property Casualty Complaints, Maryland Insurance Administration.
And we have, let's see if Cliff is on. I don't see him on. He may be popping in and out. Fred Banks is in the room. Fred, you want to introduce yourself? Yeah.
Yeah, Fred Banks, Program Manager for the Lead Poisoning Prevention Program.
Okay, Mangela Paul.
Good morning, Mangela Paul from Division of Early Childhood with Maryland State Department of Education. Thank you.
Mary Washington.
Present, Senator Mary Washington, 43rd District.
Michael Ikniowski.
Good morning, everyone. Mike Ikniowski from the Maryland chapter of the American Academy of Pediatrics.
Nadia Hutchinson.
Nadia Hutchinson, member of Baltimore Renters United.
Nicola Tran.
Hi, this is Nicola Tran, Director of the Whole Home Energy and Repair Programs at DHCD. Unfortunately, I have to leave at 10:30 today.
Okay. Ruth Ann Norton.
Ruth Ann Norton, CEO of the Green and Healthy Homes Initiative.
And I think Susan might be on the phone. Is that you on the phone, Susan? You are muted and you'd have to dial *6 to unmute, I believe. I had to mute people. We were getting a lot of background noise, so okay, somebody's on the phone. I think it is Susan. I'll follow up with her later on that. Is there anybody else?
Senator Washington.
No, yeah, I introduced, yep.
Okay, all right.
Is there anybody else, commissioner, that I did not call that is on? No, okay. All right,
So,
Ruth Ann, over to you.
Yep, that's fine. Wendy, if you'll pull up the minutes from that were for our last meeting, September 4th. Does anybody have any notations, amendations, or disagreements with the minutes? Wendy, I have a point of order here. I don't think Senator Attar is any longer a member of the commission. She's no longer a member of the House, and she is now in the Senate. And so I think technically she can't be because we have Senator Washington. So
Okay.
we should check the governor's office on that, and
Yeah,
we're still seeking. If
Well,
Senator Washington,
I think that would be the House, so you'd reach out to the House leadership
right,
so they can appoint a House member.
exactly.
yeah, I think we're still trying to find somebody, but as far as I knew, like, until they're officially removed, like, they keep listing
Okay.
her as a member, so.
100%, and
Got it.
that's, thank you, Senator, for that. Thank you.
Mhm.
All right, and But if no objections to the minutes, can I get a motion to approve, please?
So moved.
Can I get a-
Second.
Thank you. All in favor? Aye. No dissents, adopted
Aye.
unanimously. Let's move. Thank you. Thank you, Mr. Skolnick. Thank you, Mr. Banks. Let's go. Wendy, I did just forward to you or Bay, one of you, if you could put up the summary of the survey. We got 13 members of the commission, not all. If you did not have a chance to respond to the survey that we wanted to do coming out of the strategic planning meeting, we're gonna let that stay open until this afternoon. But Wendy or Bay, if you could put up the summary, I wanted to do that because I was hopeful that we could see the results for everyone, and as we start to break into committees for the work. So can't see it very well there, but let me see if I can read it here.
Is that bigger, Ruth Ann?
I think that's right. So what we saw was that the top choice of these, as we ordered the 8 things that we're going to work on, I know there were some surprises for me in this because I saw funding was the least in terms of priority, although I think it's going to be our biggest challenge for many. But the updating of regulations regarding lead status of housing came out as the highest priority of the commission, along with expanding lead safety options for owner occupied. And the third in the top 3 was working with the Department of Labor to incorporate lead worker education and certification. And that covers contractors. It doesn't cover inspectors. And so I wanted to say that. Going then to developing a public dashboard, which I think we are committed to do for resources. And the 5th, and the point of the exercise, was the strategic plan to increase resource, or not all of it, but what on pregnant women. And then working with medical professionals to increase lead testing. 7th was advocacy for regulation and research around other sources of exposure. And the 8th priority of the priorities that we will work on was the funding challenges in the federal landscape. I don't know if anybody wants to comment on that, but of the 13 respondents, this is how this came down. And there were a couple of others that were raised that were not as clearly articulated in the choices. But in that updating of regulations, it is suggested that we add in the lead-free lead paint inspection. I know that we talked about at the strategic planning meeting and a need, and I think the department is focused on looking at that. Identifying, monitoring, and educating on lead paint sources. So going to that source issue that we talked above and the issues of pregnant women. So connecting up there, and then coordinating with the rental court system to better track and have oversight of negligent landlords. We can talk more about what that looking at and ensuring lead protections are included in the renter bill of rights. Does anybody want to comment on those additions as we think about putting those in the 8 above? And Nadia, is the last one your comment potentially? And Cliff has his hand up. Yes, go ahead, Cliff.
So just for everybody's benefit, and I apologize because I dropped in a little bit late, but these were ranked, this was rank order voting, right? So are those the rank order votes based on cumulative score? Or are those ranked order votes on the basis of the first score? How was the ranking done?
It is based on the rank choice voting. You can see how that breaks down above, but the coloration of it, right?
Yeah.
The weight of first choice and then moving
right
down.
So a couple of things were interesting. I note that the largest second choice by far of the largest number of people,
Number 5, yeah.
it was the strategic plan. So it's interesting to note that although it wasn't the top choice of everybody, it was many people's second choice.
That's right. That's right. And unless anyone objects on the commission, right, we're going to try to make our agendas and where we can. And so even though we've ranked them, so to speak, it doesn't mean they're not going to be worked on, right? So Cliff, I think overarchingly is the strategic plan, right? As we do that, and that has to be the net result of this work. Does anybody have any other comments as we just go through the rest of this, right? And I think the rest of it is really committees. And as we now move into looking at committees, identifying lead poison, getting into those engagement funding policy strategy. So we're going to try to take those 8 and put them into those committees. So we will be working with everyone today, if you want to self-identify, 2 committees in direct services, policy, community engagement, training, accreditation, and funding. If we we want people to self-identify first. We want to have a commission member chair each of the subcommittees, and then we are allowed to invite to work on those committees non-commission members, if I am correct, by structure here, and I think other commissions do the same. And so we will be asking you to identify and send to Wendy the 2 committees, your priority and your second choice committee, of which we'll ask you to be spending some time in the intervening weeks between meetings. And then there were a couple of notations here around topics not listed above. So Wendy, can you pull that up, please? So we make sure that we are addressing that and trying to do that.
Where, what do you want me to pull up?
That's number 4. You just went past it.
Right there.
Identifying lead poison children, and I think that does come under the direct service work. Developing, and that's happening at direct service outreach with physicians and community engagement. Developing a working forum between regulators and inspection companies. We'll have to discuss where that might go, but I would assume in the policy or potentially in the contract, the training, and then training of lead inspection would go under the training area, I believe. Do we have a hand up? Am I hearing a hand up? Okay. Some feedback we got, difficult prioritizing these and how we are dealing with non-lead paint issues. Lead paint was the basis originally of the founding of this commission, so it has broadened its activities over time. And not raised in the comments, but raised in the strategic plan is the review of the commission structure. But we did say there were several things we were going to do that didn't necessarily require a survey, and that is getting back to the legislature on the makeup of the commission and making sure that we had transparency and that we had a better mechanism for public involvement, public engagement, and public commitment. Any comments as we start to take this into structure for the commission? Further comments? I will ask that if you did not.
I have a question. What is the overlap in regulation and in code between lead certification and DHCD. I didn't look to see if DHCD is on here, but I don't know if.
So I don't know, Nicola may be on there. But lead certification for contractors, I believe, is required for all DHCD programs if it's applicable in the work. And Nicola, that's just state law that has to happen. But what has been the big discussion, Senator, is that we don't tie Maryland Home Improvement Commission licensure to adhering to state law on
Yeah. Yeah. Is it local? We have this issue in other areas. I guess this is an important policy clarification, both from, it's probably law. We probably have to do it in law and then say that there has to be regulation written. But I do see that as a huge gap. But just in general, I don't know if there's anyone from DHCD here or if they're a member of the commission. But links to permits, who knows, even grant programs. I do think that there needs to be a stronger link. Oh yeah, Nicole is there. Yes.
Yeah, I'm here. What Ruth Ann mentioned is correct. You know, that the lead certification for contractors is a state law, and we require that for the contractors that do work under our programs, but I also see the gap with the general contractors, you know, the gap in the lead safe practices and training there. I will say it is also a requirement for our weatherization programs to do lead work and educate the homeowners on the lead safe practices. But I mean, that's really all I can contribute.
Nicola, can I ask a question before we get to Adam? In regards to this, is there anything legislatively or by regulation that would help you to ensure that the contractors that you are using are trained and certified in this area? Do you need, do you all as an agency need anything? I think in the public, I'm a huge proponent that we need to put some tie between MHIC licensure for contractors and adherence to lead. And if you violate MDE's law, you can't be an MHIC contractor. But is there anything that DHCD has identified as needing?
So, I mean, we're requiring that for our contractors without it being, you know, something, without needing anything in the law for that, just for our, you know, own safety. I think it's more a concern for any contractors that the customers choose, because some of our programs allow the customers to choose their own contractors, and there it's less, you know, something that we can directly oversee. But that's not the case for the lead programs. That's more the case for the general rehabilitation programs.
But if a state program is funding something, a scope that is, and I hate to have my back to you, I'm sorry, but if the state program is funding something where lead is being addressed, is the state not verifying that who that customer chooses is certified?
No, for the lead portions, yes, just not for other work that is done. You know, if they have a general rehabilitation project, it still needs to be lead. The work needs to be done in a lead safe manner.
So you understand my question though, right? Underline, if there's any lead on that scope, I think we need to help and assist the public by ensuring who's certified. Adam?
Yeah, I just want to, Senator, I think it's a great question. I just think that everybody needs to remember that DHCD's involvement in aggregate in housing in the state of Maryland is incredibly small that they have any control over in terms of lead. So, you know, I mean, Ruth Ann, you hit the nail on the head, and we've been talking about this for years. I mean, MHIC and the Department of Labor is one place that if those licensed contractors, if they're doing a project in a property that's pre-78, et cetera, are properly trained, that would be a huge impact. So I know the natural inclination is talk about DHCD, but in the grand scheme of things, they're an incredibly small fraction of what goes on in the real estate space in general. And licensed contractors is a much greater piece of it. And them being properly trained and knowing what they're dealing with would have a lot more impact, especially on the owner occupied, which the state legislation, I mean, the current legislation passed in 94 does nothing about owner occupied. And as we know, 40 to 50% of the kids with EVLs are in owner occupied housing. And we've been talking about this for years, and we just can't seem to get the Department of Labor to pay any attention to this
Well,
discussion.
one of the things, Adam, is the Department of Labor is not on the commission.
Agreed.
Right? And they haven't taken it seriously because they haven't been told to show up. I know that Eagle and Cliff and everybody do that out of the goodness of their heart, but we got to tell agencies it's a priority. And we have not done that. There's no education of contractors about lead when they go to take their test.
Right.
And there needs to be a required education component to pass that test. And then we need to tie the lead licensure to certification. And if you screw up on the lead side, you're going to lose your MHIC. This will be taken a whole lot more seriously on cleanup. We deal with so many contractors who just poorly address the lead issues that we have to stay on because they don't think there's any penalty to it.
Right.
Yeah. We have a comment from Patrick Connor. We'll read in a minute. Senator Washington.
Yeah. So yeah, Adam, there's just a web of places where permits happen, and it's really surprising who gets to do what types of permits and who has to sign off. So even if from your view, DHCD may have a small role, there's procurement law, there's a lot of things, there's DGS, there's the grant, there's the capital, like there are many different places where checking for this type of thing or just putting it in as part of what RFP requirements that DHCD promulgates. I mean, there's a lot of opportunity to just kind of weave it in. So I guess to that, does MDE, well, yeah, where with the permit? Is there a permit? And like we have air, water, air quality, we have soil, all that. Is there a permit that has to be gotten from a developer or repair or before proceeding?
Local jurisdiction.
Yeah. Paula, go ahead.
Yeah. Hi. Generally, it's from the local jurisdiction.
And okay, there we go.
And I just would like to add, Ruth Ann knows this. For years, we've been trying to get what used to be under DHCD, but now under the Department of Labor.
Yeah.
To come here and talk about this very issue. And I have done a little bit of research, which I'm willing to share with the commission about some laws that are on the books that may require them. We had, and I can certainly share that with our attorneys and see, what they read within. I can't remember whether it's under the building code that they have to apply with all federal and state laws. So I need to revisit that again. I haven't done that for quite some time.
So Paula, you just set yourself up. I'm going to ask that
I'll do that.
Okay, I'll ask that you report in November.
Okay.
An early meeting in November, because there is legislation I think needed on this MHIC thing. And I'm about to call you Dr. Senator Washington, which you are both.
Yeah. I'm a reverend too. I have one of those. I have one of those online Universalist Church
All
ministry.
we care about is that you get your certification as a lead inspector, and then you'll
Oh
have.
yeah.
But by the way, just a functional comment. I mean, pick a jurisdiction, right? And I'm picking Baltimore City just as an example. So if you're doing an online application for a permit, it wouldn't take a lot of work to add a question that says, was this property built
Exactly.
pre-1978? Checkbox.
Exactly.
And then follow that up with a question of, as the contractor's applying for the permit, what is your, MHIC license number, which they give, and then follow up with, if they've gone through, lead training, what is your, what is your inspector number? What is your, not inspector, excuse me, what is your approved number for doing lead work? I mean, it's not that hard. I mean, I don't think we're asking the locals to do this huge, heavy lift of asking for this information. What happens with the information once we've gotten it is a whole different dialogue. But at least we can't do anything without even the data.
Yeah. So Madam Chair, many of us are working on legislation now.
Yeah, I'm going to ask that Adam, Paula, anyone else, and let's try to get together and craft something out, and then we'll have to see whether the state can pass legislation that gives instruction to the locals permitting process. I'm unclear on that. Neil, I know you don't have a lot of time, but we might run some things by you. Is there anyone else?
Important.
Yeah, anyone else want to work with Adam and I on this? Susan usually does.
The other thing to look at while you are doing, because I'm not volunteering for the committee, I am volunteering to do the work and put the bill in if it's not going to be a departmental. But also look at the variances. We have this across the board where a local jurisdiction, there's a state law. So first of all, we can set state law. But what happens is that we allow the locals to, if they implement or pass their own law that is at least as restrictive as our law, then the contractors or the permit is required. They just deal with the locals. Unfortunately, there's a variance. So I would want to make sure that there's no variance options if there are local, because what happens is that the variance, there's a local variance, and the locals will say, you don't have to do this because it's, too much. So we have to really sort of tighten up in the permitting process where state law has set a certain standard to really.
Well, I think the backstop that is the MHIC, right? You can do that, but the backstop is the MHIC. So you have two places for confirmation.
Exactly.
There's a variance in Allegheny County versus Somerset County.
Right.
Then you can default to the MHIC process. So I'd like us, so Adam, you and I think Susan's going to say yes, and Paula, maybe we can just try to knock this out. Anybody else is welcome. We'll say when that meeting is. And Nadia, as we were kind of coming out of these survey, I know you had offered to help in any way. I'd like to ask for your help on the committee structure work and just getting the committee structure so we can get functional to that and take in comments. Would you be able to do that?
Yes, I definitely would be able to.
Yeah. Okay, great. Does anyone else want to work? And Cliff, maybe. I'm sorry, go ahead. Somebody's on phone. Is that Susan?
Yes, yeah, Ruth, I was just volunteering. If you would like it from the perspective of somebody in the training aspect to kind of help with that, I would be more than happy to help with that.
100% on the training side, Susan. And Wendy, we had a comment I saw come up from Patrick Connor. I'm not in control of the mouse here.
Yeah, there are actually, we had I don't know if you saw Barbara Moore's comment was before that. What does the direct services include? And then Patrick, his comment was only when public comment period is available. What actual information is available that documents the frequency of the public hiring contractors that are not licensed and or accredited. And then Michael Ikniowski also asks, are owner occupied homes tested, inspected for lead when sold?
Doctor, they are, there is a federal disclosure law. There has been legislation proposed in the past to require the testing, the full testing in Maryland. That did not get very far. We could strengthen the federal law by not just disclosing what is known, but require the testing as a active part of that sale process. And I think it's one worth looking at from policy and legislation. Patrick, I don't know if you can come online or not, but I think we're talking about public and private on the certification side, not just in for public contracts. So
Ruth Ann?
yes, there you go.
Yeah, thank you. And there, in order to answer further on the real estate transaction, I mean, there is a ability for any buyer to ask for a lead paint inspection as a contingency of their offer to purchase the house. We do, I mean, I see a lot of that being done by buyers with small children, or, you know, and then we educate them with, you know, by doing a lead paint inspection. A lot of that though, you know, in real estate agents, you know, they look at lead as a 4-letter dirty word because they don't want it to squelch the deal. You know, a lot of, I have seen personally a lot more interest from home ownership individuals buying older homes, requesting lead inspections.
Well, I would say that I'd be interested in the data on that. Is it wealthier homeowners, purchasers, or is it all? Okay.
You know, it's you're right. It is coming from people who have the money, because if you know, right now it is voluntary. I mean, so, you know, it costs money. So some people in the lower income, they're already struggling to just buy the house, let alone have all the necessary inspections that one might think they should have. But I do see it from middle class. And it has become a little bit more frequent in that sector.
Well, what I would like us to be looking at is what's the productive ways that we can provide and drive resources for low-income homeowners who want to get out of the rental and into home ownership, and what resources are there to help them. And they may be identified, but I think we ought to identify that. I think Patrick's comments are good ones that we need to take up and determine what committees of the commission will get those for recommendations. And Patrick, we would invite you to serve or participate as you can in committees looking at this, because you have a great amount of knowledge as well. And thank you for weighing in.
He also has another comment question.
Okay, do we see it?
Yeah, only when the public comment period is available. Let's see, why are we overlooking our EPA partners and the renovation, repair, and painting RRP rule? Also, for the longer term contributors, where's the former housing subcommittee recommendations when Baltimore City was updating their online permitting progress?
I think they ask now.
Yeah, I'm sorry, go ahead.
I think they ask now, Baltimore City does, at least the last.
Yeah, I mean, there is a great opportunity in Baltimore City right now for permitting, whether it's for rental properties or for homeowner, because they are revamping their entire system. It has been a massive problem. So we ought to look at that and maybe have Deputy Mayor Williams come in who's doing that and ask that question. Patrick, on the RRP, the one concern that I have is the RRP is significantly weaker than the Maryland law. So we're not overlooking that. It's just that RRP does not have the strength of protection for occupants that the Maryland standards do. Susan, you were gonna say something?
Yeah, Yeah. I want to respectfully disagree with that because the RRP rule does require that any remodeler working in a property built before 1978, that they have to test the surfaces before they disturb them. And if they are very, if lead-based paint is going to be disturbed, the lead safe work practices that they have to use are very similar to what is required under Maryland abatement regulations in terms of containment, doing the work using methods that help to reduce the dust, and then a cleanup. The one area that is a little bit weaker, and I would agree with you, is that they don't have to do dust testing, but it is an option to those owners of those properties under the RRP to not just do cleaning verification, which is actually done by the contractor themselves, but clearance testing. But that is an option, and it is basically, I believe, EPA's intent. It was to kind of lower the costs of doing work,
Well, I'm
as
gonna say,
abatement is being done. Yeah.
and today's EPA very clearly at the Children's Health Protection Advisory Council said their goal is to undo most mandatory regulations, move to voluntary regulations. I would, Susan, I'm not an inspector, but I think the training of RRP is weaker than what you get in Maryland. There's a whole classroom, by the way, of folks downstairs getting trained. I think it's vague sometimes in the attainment, and it's certainly vague in how we would do enforcement, and we would be dependent upon the current EPA to do enforcement, which I think is going to be less than the state can do. But this is a great thing to go to committee, look at, and certainly RRP provides a underlying baseline, but no contractor in Maryland should think, at least when touching rental property, they can get by with just RRP. Anyhow, we need to move on to the next thing. Any further comments around moving this? And I know, I don't know if he's still, he's in transit, but we'll have Cliff and Mitchell also working on the committee structures. But please reach out to Wendy where you think you can help the most, and because we're going to have, every committee will have to have a mission statement and 3 actionable items for the year that we want to get moving on. Sounds like we have a lot around this, also legislative work, and much quicker to happen. And I know that Senator, there's a lot of public education money that I think needs to be out there that isn't there, so it can reach in all areas. So let me move to the next thing, and I want to thank the Department of the Environment and the Department of Housing, Community Development, and many others throughout the state. We have put together an 11-agency response, both working with emergency management at the state and DHCD, to look at the housing in Western Maryland and try to get houses, especially in Westernport, who were impacted by the climate issues and reworking of how water flows. The town got flooded out. There has been a lot of money to try to clean up the muck and mold and mildew and moisture. And those immediate cleanup efforts haven't held. The houses are again filled with muck. We just walked through them about a week ago. Our organization, Maryland Physicians Care, Allegheny County, the state of Maryland, a number of others. And we're trying to get that permanently addressed. And I will remind everybody that a young man died of a mold-induced asthma attack as a direct result of the floods, a 16-year-old in Westernport. But what has come to be a critical issue, and I had a meeting with Secretary Day last week about this, have not had a chance to follow up with Nicola yet, is almost every single house, there is severe exposure on lead. And we are working to try to find either supplemental funds at HUD that have been returned. There were funds that were returned back even by the city of Baltimore on lead, and trying to get those funds that were returned and unused reallocated to this effort. But we're looking at a number of different things that need to happen there, because there's no doubt the exposure is very high. We have problems, the other problems that we're getting the mold, the mildew, the muck out, so that the state, who's allocated money for new heating systems, heating cooling systems, can't even get done until that is addressed. And I just want to say that we went out there as an organization looking at asthma and came away not only looking at the needs for asthma, but the needs for home repair. And so we're going to continue to look at that issue. And I want to also just say that it was Maryland Physician Care who called first on this. And it is critical, our healthcare partnerships, to identify needs, and even where they can't do something, to really listen to their constituents. And we're going to see what the legislature can do to provide a little bit more money. And one other reflection on this, and for all the things we're doing, the real need to have people that sit down and actually do application assistance, hands-on application assistance, not just hand an application, or not in doing that when people are in trauma and they're really trying to kind of piece it together. We need to have those active case managers on the ground doing that. And it is a reminder that lead paint and other lead issues don't just happen in Georgia County and Baltimore City and Baltimore County, in the far reaches here, right up on the Western Virginia line. We have significant issues and very few kids getting tested. We did hold public testing. We only got one family to agree on it. And we are working to do this. And Doctor, you are correct. FEMA declined to help Maryland citizens here. So I'll just say that we, GHHI and the state, are looking on how we can bring money on lead there. And we're going to talk to MDH about their lead program and as well. But I did want to, I promised to give an update on that. And I know, I think Bay Hansen and Carly Ferta Bowman are on the line here, and they participated. I don't know if they want to say anything to that. And Nicola, I really appreciated DHCD's team out there, and we want to get you the right help so that your money can get used, because winter's coming, and taking 3 more months to get mechanicals in will be in the heart of winter, and is going to put older adults and kids with asthma at risk. But we got to also take the opportunity to take care of the lead issue. If anybody listening on this from the public or on the commission can think about ways that we can address this emerging issue on lead, please talk to me offline and or make a comment now. But I did want to give that update.
We have another comment from Patrick Connor, if you would
Yes,
like
sir.
me to read.
Yeah. Can you come on, or just go ahead?
Yeah, Ruth Ann, I don't want to interrupt the commission at all. I'm just putting in
Well-
comments when the public period's available. Please,
Okay.
please don't
got it.
think you have to do anything. Thank you, though.
All right, thank you, sir. Former Commissioner Patrick Connor. All right, and thank you, Bay. And Bay is one of the people helping to spearhead this. The Just Communities, we have requested that the state come and present the Just Communities program. We think there's a lot of overlap here. And we've also, I've talked to the city of Baltimore, hopefully in next meeting, that they will come and present their vacant housing plan, because there's going to be a significant amount of lead that's there, making sure that they're doing. And lastly, we have an invitation out also to Sheriff Kogan in Baltimore City, who, when doing warrants of eviction, is checking the Maryland law. And if the landlord is out of compliance with the lead law, the sheriff's office is standing down on the eviction until that is resolved. And I think that is a national model. So we're going to have Sheriff Kogan come and present what they are doing and what support they need to be doing. But that could be quite significant in help for the rental community. We wanted to get an update too from the lead grantees. So I know the city of Baltimore is represented here by Kat Taylor. Nicola's online, and I don't know if any of the other HUD grantees who have healthy housing or lead money are on. But could Baltimore City just give us an update of their current status on lead?
Yes, hi everything, hi everybody.
Good morning.
Please don't mind my voice, I'm just a little under the weather today. But so far with the federal shutdown, our operations have not ended, which is great. HUD has informed us that they do have representatives working under essential status to make sure that our operations are still moving. Currently with our new grant that we were awarded back in April, we were able to actually complete 4 units, which is already surpassed our expectation for this quarter. We do have at least 6 other properties scheduled to start this month. And we do also have additionally 7 that have not been scheduled just yet, but they are under obligation and contract. In regards to our outreach efforts, we have received a lot of referrals recently through our partnerships. So right now we actually have almost over 100 applications of interested individuals within Baltimore City, which is really awesome. So right now our focus has been just making sure we get in contact with each person and moving their case along. In regards to our outreach, we are also trying to do some more social media interactions. So I am going to put our handle in the chat for you guys to follow us and just to interact with us. There we can post anything that is going on with our program as well. We have Facebook, Twitter, and Instagram. And we also will be helping out the health department in regards to the Lead Week that is coming up in regards to the outreach. And one of the things
that's on October 24th and 25th, I believe, at Curtis Bay Elementary School, right?
Correct.
And there will be a whole schedule of that up on GHHI's website. We'll send, and Shadi's going to talk about this in a minute, but we'll send that out. But there is testing going on there, right? Could I ask for future commission meetings if it's possible that you all could do just a dashboard report on the number of applications in the pipeline, number of units that have been cleared, and any other key facts? Just update that monthly so we would have that, so that the commission does know how we can support you.
Of course.
Thank you so much. Nicola, any updates on, or Theo, any updates on the lead programs that you're overseeing, or programs that are addressing lead?
I can defer to Nicola first.
I don't see her on anymore.
I think she
might
had
have had
to
to
right.
go.
She had to leave.
She had to go.
Yeah. Go ahead.
Just remember that. Okay, so for those of you that are not aware, MDH oversees a home visiting program for those kids both with elevated blood lead levels and asthma. And for our blood lead level component, we just checked the numbers. We have approximately 500 kids currently enrolled. Now, a portion of those enrollments are kids that do not yet have 2 under 3.5 blood lead levels. So that doesn't necessarily mean that we're conducting active home visits for approximately 500 some odd kids, but that is the number of kids that are currently being tracked in our system. So still a substantial portion. Those do span several fiscal years. For the last fiscal year and a quarter, however, that does come out to be, or less 2.5 fiscal years, my apologies, about 400 some odd kids. So some older ones that are still need those 2 3.5s, but generally more recent cases. Happy to answer any questions about our services.
Theo, can you say how much money is available currently for lead projects or lead or asthma projects for the intervention side?
Sure. So our award this year this includes state dollars, both from the general fund and HSCRC, along with federal Medicaid matching dollars, is about 4.5 million. So we have awarded all of those dollars out. Those go to 11 local health jurisdictions, our nonprofit partners, and then our internal EHB costs. So those have been fully awarded, and our local health departments are spending down those dollars accordingly.
And when will the renewal come? Not till next July?
Correct. We do go by the state fiscal year. So yeah, it will be July, and of course, we'll have a better sense of our award in April when the state legislature wraps up, when we know our budget allocations, as you very well know.
So let me be clear, there's $0 available for any lead issues from that program until next July.
You mean like that are to be awarded?
Yeah, so
Yes,
for
correct.
example,
Mhm.
those families in Westernport or where there is not a lead program specifically for that part of the state, there's no funding available from your program. Is that what I'm hearing?
No, I appreciate you bringing that up. We do have additional funding. Oh, Dr. Mitchell, I see you came off mute. Would you like to talk about the ASTRO funding?
Yes. Thanks, Theo. Ruth Ann?
You have to talk in a Boston accent if you're going to be calling in from Boston.
Yeah, I can do that, but I'm going to get.
We'll do that another time.
I will do that another time. Yeah. And I'm sorry to interrupt, but I just wanted to say I appreciate the question very much. 2 things about that. The first is to acknowledge that the county health department out there has been very involved in Westernport on its own, working with other state and local agencies. But we, in addition, have awarded, we've received funding for the last 3 years from the Association of State and Territorial Health Officials, ASTO, which has been awarded for lead case management through ASTO to the department, and we have dispersed those funds to support lead case management in the 13 jurisdictions that are not funded through the Medicaid CHIP program. That is the only dedicated funding for lead case management that is available to Allegheny County, specifically from the Department of Health. There are other funds that could potentially be used at the discretion of the local health department under local decision making, but there's no specific line item funding for lead case management for that for the county. So we've taken advantage of the ASTO funding, which this year was about $225,000 to provide some supplemental funding to fund personnel, obviously less than an FTE's worth, to support lead case management activities.
Yeah.
Rehab.
Yeah, I'm thinking of and first of all, that's fabulous. I'm thinking of the rehab dollars.
Yes, and I wanted to be clear about that the department has no funding that is specifically for interventions other than the funding from Medicaid CHIP that is for durable goods. And again, that's limited to durable goods that are approved by CMS, the Center for Medicaid and Medicare Services, which includes HEPA vacuum cleaners, dust covers, pillow covers, etc. But it does not include construction or renovation.
Okay, gotcha. All right. Sorry, lost my thing here for just a second. We will get an update in next meeting from Nicola, and we'll also ask for the other two Healthy Homes production grantees, Howard County Community Action, and the one on the Eastern Shore to report to us next week, in 3 weeks. Shadia, are you on the phone to talk about lead poisoning prevention week, which is
Yes, I am.
the best for last here before we get to things. And there is an extensive, I want to just say, an extensive partnership here, many other groups that are doing things. And what I will ask before Shadia starts to present is if you are doing things or you know of things, please let Shadia know so she can put it on the global calendar for the public for all events. But Shadia, go ahead. And this is Shadia.
Ruth Ann, we have a question from Michael Ikniowski real quick. Do you want to take that?
Yes, Doctor.
Okay, he says, would it be possible to fund lead care 2 devices to increase screening in Western Maryland? I know that case management will be a pressing need.
Cliff? Or Theo?
Yes, so we have already dispersed the 3 lead care 2 devices that GHHI received from the EPA, and those have gone to Dorchester County in the Eastern Shore, to Anne Arundel County, but the third one actually did go to Allegheny County specifically for that purpose. And so they are in the process of trying to get that up and running. Mike, that was a good.
And we also shipped 3 more to the very good doctor out there in Allegheny and Garrett County.
3 more lead care 2 devices or the test kits?
The kits, yeah.
Yeah, the test kits for the device.
Yeah.
Yeah. So, Mike, it was a good question, and I think I just want to express my appreciation to Ruth Ann and GHHI. They received those kits from the EPA, and we were happy to work with them to get those into the hands of local jurisdictions other than Baltimore City, which has already been doing testing using lead care 2 devices.
And it is a reminder that for all things going on in the world, EPA has said lead is a priority. So, Shadia, thank you, Shadia. Now we just need a small warm up by Cliff. And now you're
Always, Cliff. Good morning, everybody. So as a reminder, I'm Shadia Musa. I'm the Outreach and Education Manager with Green and Healthy Homes Initiative. We have been planning a very robust week for National Lead Poisoning Prevention Week this year, which occurs from Sunday, October 19th through Saturday, October 26th, I believe, or 25th. So we have a whole slew of events. So on Monday, October 20th, we will be doing a read aloud with a partner school, Hartford Heights Elementary. And we'll be doing a read aloud with Derek the Dinosaur to again encourage students to learn about safety habits for lead poisoning prevention. The following day, we're going to do a webinar for lead laws and tenants' rights. The audience is intended to be property owners, and that will be with myself as well as Wes Stewart from Green and Healthy Homes Initiative. They is putting the schedule of events in the chat, so you guys can take a look, as well as some of our registration links for the events throughout the week. on Wednesday. Wednesday is our big day, and we are so excited to partner with Dorchester County Health Department and the Packing House in Cambridge, Maryland, to host 2 events. So at 11 a.m., we're going to be doing a lunch and learn on lead. We're going to have some amazing speakers from Dorchester County Health Department, MDE, MDH, as well as Green and Healthy Homes Initiative, engage in some really important discussions similar to what we're having today about what really needs to happen in the state in regards to lead poisoning prevention. And then after that, at 3 p.m. At the same location, we will be doing a community resource fair with a bunch of different local organizations, free ice cream, games, music for children and for kids. So we are really, really excited to kind of move those efforts over to the Eastern Shore in Cambridge. Cambridge, I believe Dorchester County received a Healthy Homes Production Grant from HUD. So this is a really imperative space for us to be in. So we're really excited to bring our efforts over to Cambridge. On Thursday, we're going to be doing a trunk or treat, or what we're calling treats, tricks, and lead safety tips at the GHHI office. So we are inviting a bunch of our partner schools in the area, Canton. We are also going to be doing some canvassing as well around the GHHI office to have a bunch of kids come to our office and engage in really fun activities with our staff. And then we're partnering with Baltimore City Health Department for Friday and for Saturday. So Friday, like Ruth Ann mentioned, there will be blood lead testing at Curtis Bay Elementary School from 9 a.m. to 1 p.m. And on Saturday, there will be a community resource fair at Curtis Bay as well from 10 a.m. to 3 p.m. So like I said, they put all of these schedule of events in the chat. You all should be getting emails very shortly. And again, if anybody would like to volunteer to assist with some of our efforts, especially in Cambridge, Maryland, Bay is putting a vendor registration link in the chat. Again, if you would like to come down to Cambridge and to table or to support and to volunteer, we would absolutely love your support. So go ahead and reach out to us if that's something that interests you. But again, we are really, really excited. This year's theme is from awareness to action. And I think it comes at a very, very imperative time, especially considering the current political landscape. So we are still here at the state. Lead is still a priority. It always will be a priority. So yeah, really excited. Does anybody have any questions?
Let me add one thing if I can. Also, and we'll add this to the details, GHHI on October 23rd at 1:30 is teaming with the New Jersey Department of Health and Rutgers University, and part of its Rutgers and Hopkins longevity study. And the team there will be presenting lessons from prenatal and perinatal population screening for lead and mercury. And we asked to do this national webinar with them because what they presented at our New Jersey lead convening that we held back in GHHI hosted in our New Jersey work in June. The data and the depth of the data, and actually the astounding impact of what is being transferred in the fetal blood like transfer, what's happening in pregnancy and for newborns on the impact of lead and mercury was pretty astounding to us. And we thought that we wanted to make sure that this got shared around the nation. So we will be also running that webinar. That will also be in our list of materials that you'll see. And we invite you to join those 2 webinars as well. But for those who have expressed interest about pregnancy and perinatal work on lead, I think this might be something of great interest. Shadia, thank you. Does anybody have any questions, or if you would like to make sure your events, whether it's canvassing or outreach, or if you feel there's an area that's not being addressed during Lead Week, please let us know. We are also going to be releasing, I think, at the end of this week, the social media toolkit. And we will also try to encompass in what we send out other things, including Baltimore's Instagram account that they put up, Baltimore Lead Safe, I think, and others, to make sure that there's wide reach in this week for lead. Any questions? Any comments? Anybody want to dress up as Derek the dinosaur? Okay. Fred is volunteered. Fantastic.
Actually, I want to really quickly I want to shout out the planning team. I really got to give a huge shout out to Bay Hansen, Carly, Jeanette, Celicia from the GHI side, but of course, our partners at MDH and MDE, Baltimore City, Dorchester County, and Baltimore County. So thank you all so much.
I think you froze when you were saying MDH.
Oh, well, MDH
and
MDE.
And Montgomery specifically.
Yes, all of Montgomery. So thank you all so much. It's been a collective effort and amazing to work with you all. So thank you.
And Johnny,
Yes.
I do think
Ditto.
during that week, we're going to do some social media highlighting of what's happening about a sheriff's office standing down because they're not doing the evictions when people are not complying with the law, because that's what the law says. So not yet. You came on camera. I didn't know if you have anything that you all are doing during Lead Week, or you just happen to come
No,
on
I,
camera.
I unfortunately I'm going to be out of town for half of the week, but if there's another opportunity to be Derek the dinosaur, I would love to dress up as a dinosaur.
Well, like the heat pump, we can always loan him, right? As long as he wears his ID badge. The history of Derek the dinosaur is before Barney. There was Derek the dinosaur, who was the star of Derek the Dinosaur's coloring book about lead, which Judy LeKine was the author of that back in the early 90s. And we also have those coloring books available still. Okay, barring anything, we are going quickly to agency, and then if we please be mindful to preserve some time here for public comments. MDE, anything you'd like to share?
Just getting ready for Lead Week. Also, renewal season is coming, so if you know property owners, landlords, remind them to renew their registration. We also made some fee updates for
Can I
them.
stop there? Are you going to do social media about that?
Yes.
Okay, Dave is great, right? If he has the social media, share it with us so we can all lift that up. Okay.
Gotcha. Fee increases. So there's a fee increase for the lead-free certificate, went from $10 to $30. That's actually in effect now. And hopefully by the end of the year, the increases for the registration fee will be posted on our online rental registration system. And that'll be for $30 currently. It'll be going to $75 every 2 years.
You got a tiny bump, basically.
$7.
$7 month. There you go.
That's it for us.
No tariffs.
No.
Got it. Nothing else from MDE. Theo, MDA, and Dr. Mitchell.
Yeah, Dr. Mitchell had a hop, but no other updates for us. We gave them already. Thank you, though.
Okay. Michael, for AAP, anything?
Yeah, it's going to be making a short video to go on our social media for Lead Poisoning Prevention Week. So I'm working on a script for that to encourage lead testing, and going to do a little field work to see if the law that was passed on lead in baby foods has reached the shelves of the grocers. I don't have any young children or grandchildren to shop for, so I'll have to make a special trip to look at baby foods on the shelves in the stores and see if they do have the QR codes that identify lead testing on the foods that are out there for people to buy, and make a point of spreading that information.
I think that sounds to me also like a great intern project for folks in public health, to get some public health interns out there that week doing it. So, but we look forward to that. If you get those videos of those things, please share them with Shadia and others so that we can illuminate them and lift them up. We want to make sure we do that. Mantala, are you all doing anything for Lead Week?
We are waiting for any type of social media information from GHHI or from MDE so that we could share with our community partners, including childcare community.
Okay, well, we will work with you to do something specifically for childcare too. We'll try to do that.
So Mangela, your name came up yesterday. Myself and Dr. Mitchell met with WSSC. They do replace water lines. And daycares came up, so they're probably gonna reach out to you just to give you a heads up to get some information on
That's the
daycares.
Washington Suburban Sanitary Commission.
Yeah, so.
Will
All right.
do. Thank you.
All right, Benita?
No, nothing here.
Okay, Nicola, any other things? We've taxed you a bunch. She's gone, sorry. Nicole is not here. Kat, or is the Baltimore City Health Department on? Anybody wanna, Brianna?
Good morning, Brianna speaking. Just a couple of updates. I just wanted to announce that Camille Burke was promoted to Chief Operating Officer. So she's no longer the Assistant Commissioner over lead in the other agencies. Jennifer Martin, 15 years with in the Baltimore City Health Department, very well known within the population health and public health community. She's not on today because she's just tying up some loose ends, but I will be making some introductory emails and getting her acquainted with the lead commission. When it comes to lead week, just want to reiterate, Friday we'll be at Curtis Bay testing from 9 to 1, and then on Saturday we will be having a resource fair providing lunch to those who are participating and engaging. I do ask if you are partnering with us to come out. If you're coming out, one, bring your own table, and two, make sure you bring a lot of education materials to pass out to the families. Curtis Bay Elementary in that community, the coordinator told me that the students, it's about 50% Hispanic and Spanish speaking. So we will have the Mayor's Office of Immigrant Affairs there. We'll have translators there. And due to the current political climate, we aren't able to get into a lot of homes. People are hesitant to let us in their homes for inspections and home visiting. So we just want to reiterate the importance of lead testing and lead poisoning prevention, and just make them feel more comfortable with letting us in the homes.
Brianna, we have a number of GHHI staff who are fully fluent in Spanish. If we can also ever be a partner to help build trust with the family, please let us know, whether it's on the inspection side, on the home visiting side. I just want to offer partnership support with families where you might be having difficulty, to at least have people that can reach out and build some trust, build a bridge for you. We are more than happy to do that.
That is greatly appreciated. I thank you for that.
Actually, I know we're trying to get you over to the office, and maybe we'll have you over and we'll have a meeting with folks who have those capabilities, and at least you can meet and we can bond up on that so that we make sure that we're building trust and protecting families.
Sounds good. I just have one last announcement. So we have hired some community health educators. We have a little bit more help. We usually test at the immunization clinic on 1200 East Fayette 2 times a month. We're having a testing walk-in clinic this Tuesday, the 14th, from 10 to 2. Moving forward, my goal is to provide the testing dates and times so that could get circulated for walk-in testing at the immunization clinic.
That's excellent. Fantastic. And can you please share, if you share that in an email to Wendy and me, we will make sure that people spread that. And do you have social media going on that we can promote?
Yes. I'll send that to you as well.
Thank you. And by the way, you've been on the job now, what, a year? Is that right?
No, not a year, just 9 months.
Well, I have to say, just what a fabulous job you're doing, and Kat also over at HCD, and just congratulations on really lifting the work and doing so well. So thank you
so much. I appreciate it.
All right.
Hey, Ms. Adams, I got a question for you. The testing, do you have to live in Baltimore City to get tested?
No, so what we'll do, we have a lot of kids who come from other counties, and we'll just refer out. It's basically, you'll have the documentation to provide to a primary care provider. We're also working with the site clinics. So a lot of people that we're helping do not have primary care providers. So we're linking people who don't have primary care providers based on their county, their address, things like that.
They're not doing the testing now, I don't think.
On the Tuesdays, the Tuesdays is you don't have to live it. Or,
Anybody can get tested, so.
Yes, it's
Okay.
All right, that's great.
Okay, we have it here as Young Gifted and Green. It's Young Gifted Green, Baltimore Young Renters United, Nadia, Sustain Our Future, all those things.
I don't have any updates right now. Yeah, I will just, I guess, maybe give a larger update that for Baltimore City, currently exploring legislation for Safe Homes Now, which is on leasing and like different rental license issues. Just recognizing that
What is Safe Homes Now?
Safe Homes Now is a coalition that includes Baltimore Renters United and a few other organizations that are interested in increasing the housing conditions for renters. And so they're looking at a host of bills around landlord licensing as well as mold right now.
Mold is a big, big, big issue. Delegate Shanika Henson is the lead in the state legislature on addressing issues of, just so you're aware. If he needs to know that. GHI will pass. I think we've talked unless, well, I will just say, is anybody on the staff want to say anything else who's on? Got it. Good. All righty. We want to open up for any other updates and public comments. And I know Patrick's there on the public comment. Anybody else? Wendy, do we have lined up?
We do not have any others, but I don't know if you wanted to address Mr. Connor's go through these, or are we doing this offline, or
I think we're going to have to, it looks like a lot, Patrick. So I think as we are looking at the committees and the goals of the commission, we will take this in and try to answer these questions, which we will share the questions answered with the full commission, and maybe have a more prepared discussion in the next meeting, if that works for you, because we want to be thoughtful. These are a lot of questions.
Absolutely. All good.
Okay. All right,
we
Nadia.
do have Nadia's hands up.
Yeah, just a quick question around the strategic plan. Are we going to be able to have an opportunity for public comment for the strategic plan itself, or I'm just interested in the next steps there beyond the creation of the committees?
Yeah, I want to get the committees and the goals and have that. It's sort of like a high level outline plan, and then try to have a forum for public comment. I want to work with MDE on how we do that. And that's not just a commission meeting, but is a meeting, one, 2, or 3 public comment sessions on that. Would love some input on, setting those up. But I think we have to do it not just at a commission meeting where the time feels tight for public comment at the end, but to give more room for public comment. Does that answer your question, Nadia?
Yes, it does. Thank you so much.
And I'm hoping to make sure we have this before the end of the year, which I know sounds ambitious, given everything, but I think we have to in order to go into 26 with clarity. Okay. Any other questions, comments from the public? All right. I hope that we will see everybody at the events for Lead Week. If you are a member of this commission and you have not responded to the survey, please do so. Because if you're here, we want your voice. We want to hear from you. We want to make sure we've got everyone. The second thing is, please be a great partner during Awareness Week. It's awareness every day, of course, but lots of people are putting lots of effort in. Let's lift that up. Let's spread this message across the state. whether it's a contractor or inspector or whatever it may be. And then the sentencing for Mr. Barkley is in February, and likely, I assume, the court will take amicus statements or statements of impact. Fred's going to let us know on that, and I encourage that we have impact statements so that we use this opportunity to make communities aware. So, anything else? All right, we will close for the good of the order, and thank you for lifting up Children's Environmental Health Month, participating in Lead Week, and we will see you in November. Thank you.